to come back and catch up. We're facing the challenges of overheated economy, 800,000 people moved to this province. The same things were happening again. People were dying in the emergency rooms. I'll share the story of my father. The reason I share my father's story, he's sort of like Red Fox. He's been in the ICU 3 times a year for about 10 years. If I was a doctor and I'm a member of government, if that's happening to my father, the question is what's happening to your father or your mother or your child or your wife or you. On October 8th, Dr. Paul Parks raised legitimate concerns that the system is on the verge of a potential catastrophic collapse from effluents. Our emergency doctors, the emergency doctors and nurses and the frontline staff are probably the toughest staff in the healthcare system. We don't cry wolf. If they say something, you better listen.
It's about time!
We've had a number of people who've died, unfortunately, and really, my heart really goes up to those families. Not only those who've died, but many who've actually suffered needlessly, meters from care. There's nothing more unfortunate than being in the wealthiest province, in the wealthiest country on this planet, sitting in a waiting room, 5 meters from care, and you're having a heart attack and you have to wait about 5-6 hours with a ruptured appendix, with a ruptured ectopic pregnancy. You overdose and you're waiting in a waiting room. You're suicidal and you actually have to leave without being seen. When Dr. Paul Parks aired these concerns, as a physician, we have a duty, we have a moral and ethical code of conduct as physicians. We have a covenant with the public as all healthcare workers to be honest. Secondly, I was born, my grandfather was a doctor and he was a sugarcane and dairy farmer 12,000 miles away. Our family always told us to tell the truth.
Amen.
We were told the truth will never hurt you. So after Dr. Paul Parks' letter, I had to be honest and tell the truth. And in fact, I was quite vocal before I got elected. I had called it a crisis in 2007. I was convinced to work within the system and not on the headlines. And to be honest, I've done that to the best of my abilities. And what happened was partisan politics collided with the values, with Albertan values actually, and Canadian values to tell the truth, and the values of a very honorable medical profession, and partisan politics won. At this point in time. And secondly, as you know, the healthcare system was not perfect. There were many good things that happened here, but there were many things that needed to be fixed. That's why I ran and many of my healthcare colleagues supported me, and the good people of Edmonton Meadowlark supported me. We needed to fix things. What we actually did was, the previous minister actually bashed the system to bits. The frontline staff are demoralized. The physicians and nurses, their morale is between 25 and 36%. They're absolutely demoralized, and yet they go to work each and every day while people are sleeping in their homes comfortably. These 100,000 healthcare professionals, whether they're cleaning staff, the unit clerks, the nurses, the respiratory therapists, the dietitians, they come to work each and every day to look after the 3.6 million Albertans. 24 hours a day, 7 days a week.
Healthcare staff are people too.
They
only do so much.
Under the previous minister, there was a code of conduct, a very dictatorial code of conduct, so you can't speak out. Dr. Duckett didn't bring it in. In fact, he took it out. There was a there before now. The emergency issue had gone 30% the wrong way before Dr. Duckett arrived. He walked into a mess. You can't lynch a poor fellow who shows up. The question is who hired him and what was the state of the system before he came in? These are the other criticisms that are raised. And most recently, you heard about a document. This is probably the most important part. So we're to have legislation moving forward. Now, this document represents the caucus, one of our elected members. It's split up into phase 1 and phase 2. Phase 1 of the consultation that we will work with. Phase 2 is the stuff that comes after the next election, which is private insurance and physicians working in and out of the system, and putting stuff under regulations. which basically is the third wave privatization of healthcare.
We're not having it!
And it's my duty to be honest to the public, and at the end of the day, you Albertans need to speak up and make your voice heard. Thank you so much for coming today. It's been an honor. I truly have
Thank you, Raj!
Thank you. God bless you all.
Let's hear for Raj Sherman!
That manifests itself in the emergency room, and also it's also a societal problem. Homelessness, poverty, addictions, illiteracy, the social determinants of health. These are the issues we need to deal with. So really, we all need to be a little Indian. The real issue is home care and home care, home care. We have to look after our parents and grandparents. Subacute care, rehab care, palliative care, hospice care. The most tragic thing is to see a senior or someone who's dying of a malignant illness, dying in an emergency hallway, half naked, with a thin little blue gown and a thin blanket with the whole world walking by. That's the biggest tragedy that I've seen. And then we do need to build long-term care. And then if we need acute care beds, if we deal with that, we'll actually have 600 empty acute care beds. That's in the output sense. And secondly, in the input side, we have too many sick patients. We need to really focus on primary care. Get everybody a good family doctor, or better yet, a team of healthcare professionals that work together as we do in the hospital to focus on the patient. The real solution to healthcare is asking us not get sick in the first place. Let's eat a little bit less, eat right, move a little bit more. Let's work on school wellness, workplace wellness, let's get junk food into the schools, community wellness. Let's get out and involved in the streets. These are the real solutions, but at the end of the day, what government needs to do is have the toughest performance and accountability measures in the country. That's exactly what we introduced with the filibuster. And in fact, this is not an NDP, liberal, conservative, wild rose issue. It's an Albertan issue. It's a humanitarian issue. Something wonderful happened in the legislature during the filibuster. Can you believe, on the amendment that we had was the national guidelines, the Canadian Association of Emergency Physician Guidelines, developed by Dr. Chris Evans, who was actually the head ER doctor in the nation. He works at the Royal Allied. He's my mentor. We asked them to be legislated as the toughest performance measures in the country. And every political party of the opposition was actually united. We may have disagreed how to get there, but we actually agreed that we must hold those who administrate, from governments to even healthcare workers, accountable and responsible in delivering healthcare. So, listen everyone, my toes are freezing and cold. The emergency departments are plugged up. We don't want to live with frostbite. Thank you so much for coming out here. Support